I founded RAIN in 1992 when I saw that many people with AIDS were suffering with their illness and trying to manage their day-to-day emotional and practical needs. Family members were overwhelmed with caregiving, and some people simply had no one to help them get their medicines, their groceries, or provide companionship. I started training congregation-based volunteer care teams to provide friendship and practical assistance to people with AIDS. Together we work to not only care for people, but to dispel the myths and misinformation about HIV through community education forums and training for faith leaders. Our 13 professional staff members and volunteers provide a range of services to help HIV-positive youth, adults, and senior adults obtain self-sufficiency. We remain deeply committed to promoting respect and dignity for all people living with HIV through compassionate care, education, and leadership development. We link HIV-positive people with health care, counseling, housing, support groups, pastoral care, emergency assistance, and transportation. We are heavily involved in advocacy and helped create our statewide HIV advocacy network. We work with volunteers, consumers, congregations, and policymakers for expanded HIV services and for an end to discrimination against people affected by this epidemic. RAIN is successful because we've earned a reputation for compassionate, high-quality care. We've served the community since 1992, and our relationships span this diverse community. Our success is due to the generous people who comprise our RAIN family, the interfaith community of volunteers, HIV-positive consumers, and dedicated staff members. Business leaders who assist with planning, marketing, and development, and community partners who work with us to provide a continuum of care for our vulnerable HIV-positive citizens. RAIN's expanded staff and volunteers have framed the community's dialogue about HIV/AIDS, replacing judgment with understanding, prejudice with compassion, and ignorance with knowledge. RAIN's capabilities include a strong, committed board and professional staff, plus a cadre of supportive volunteers and community partners. We are responsible stewards of the gifts that the community offers through grants, fundraisers, and annual campaigns. We involve persons who are HIV positive to help guide the organization, and our staff members participate in national meetings to stay abreast of best practices, new perspectives, and strategies. For instance, 2 of our staff members recently completed master's level training for chronic disease self-management at Stanford University's Patient Education and Research Center. RAIN tracks success through detailed reporting methods and client achievements. Client successes are related to goals to increase medical compliance, ensure access to medical care and medications, reduce risk, and address mental health or substance abuse. These indicators are measured through a detailed database, allowing staff members to accurately evaluate and analyze results. Data indicates the agency's strengths and weaknesses and allows for supervisors to strategize plans to maintain successes and implement improvements. Metrics for case management indicate that 91% are maintaining their medical plan and 57% have been placed in safe, affordable housing. Many people may not know that we're here for anyone who needs our help at no charge. We support anyone struggling with an HIV diagnosis as well as their family members and partners. Our case management services are comprehensive. Case managers are able to accompany clients to physician appointments or meet them at the homeless shelter. They have a can-do attitude when it comes to finding just the right resources to help people overcome any barriers to their health. We work with people from a variety of faith traditions and no faith tradition. All are welcome at RAIN. "55% of all new HIV infections in the U.S. occur among youth ages 18 to 25. Teenagers and young adults need specialized support services to break stigmas and barriers to care and help them reach important goals like graduating from high school, attending college, or job training. RAIN's Empowering Positive Youth, or EPI program, is one of the very few youth programs in the entire U.S. We are proud to report that 95% of EPI youth are receiving medical care. 81% are on antiretroviral therapy, and 49% have suppressed viral loads. Centers for Disease Control data and other sources show that the southern U.S. has the highest numbers of HIV-related death rates, more than any region. A study of morbidity among HIV-positive individuals found that HIV-positive people who live in the South are also significantly less likely to have started antiretroviral therapy in comparison to HIV-positive individuals living in other geographic regions. Ironically, funding has not kept pace with the South's HIV epidemic. Instead, it has left us with fewer resources to respond to citizens with the greatest needs. Our community is challenged by a severe lack of mental health providers. Additional funding would enable RAIN to provide a more comprehensive continuum of care for low-income HIV-positive people by providing mental health services. We've also observed that many senior adults with HIV need volunteer support to manage their health challenges. We'd like to expand the work of our part-time chaplain and volunteer coordinator to meet this growing need. Furthermore, the success and growth of our EPI Youth program is outpacing our capacity to respond. We need additional staff to meet the needs of HIV-positive youth. There's a critical need for additional case managers to fill gaps by linking patients to medical care, providing interventions to delay disease progression, and to decrease barriers to retention and care. Bilingual case managers are especially needed. Case managers enhance an individual's ability to obtain optimal health outcomes and are able to identify barriers that would prevent clients from achieving optimal outcomes, including an undetectable viral load.